Hi, everybody. A very good afternoon. Thank you all for finding time and joining this today's webinar. A very warm welcome to all you speakers and participants in our webinar today. She helps her thrive. My name is Dr. Priyanka Kocher, your host for today. I'm a senior program officer at EngenderHealth and passionate about implementing evidence-based and sustainable health programs, especially for adolescents and young people. For decades, EngenderHealth has had a youth-centric approach to its programs and has believed in meaningfully engaging them in interventions for their own health. At EngenderHealth, we believe that young people are experts in their own health and rights and hold the power to develop comprehensive and successful solutions for their own health-related challenges or their communities. The webinar captures some of our learnings from a similar 2-month initiative in Sitamarhi district of Bihar to improve the survival of newborn girls by meaningfully engaging Adolescent Girl Champions. In this webinar, we'll hear from all our speakers, our panelists, about why they think this is a promising approach. We'll also hear from the AGCs themselves, our champions themselves, their experience of engaging in this initiative. Just a brief heads up, all microphones and cameras are disabled for participants. However, you can type your questions in the QA section, and as we move along, we'll try to address your questions. I now invite Dr. Ajay Khera, Country Representative EngenderHealth, for a brief introduction of the project. As we all know, before joining EngenderHealth, Dr. Ajay Khera has served in the capacity of Commissioner for Government of India's RMNCHA program for more than 10 years. He's a well-recognized consensus builder and a person of great repute in advancing the maternal child health and adolescent health initiatives in India. EngenderHealth is really honored to grow under your leadership, sir. Over to you, sir. Thank you.
Thank you very much, Priyanka, for this nice introduction. So first of all, on behalf of EngenderHealth, I shall like to extend the warm welcome to all the participants of this webinar that is titled, She Helps Her Thrive. And at the outset, I will also like to acknowledge the presence of Mr. Luigi from UNICEF, Anand Sinha from Packard Foundation, and Dr. Zoya from the Ministry of Health and Family Welfare as the head of the Adolescent Program of Government of India for joining with us as speaker and guest on this important occasion. During this particular workshop, we propose to share the learning from an initiative where we tried to meaningfully engage adolescent girls as champions in addressing the survival of the newborn girl child. And as you're all aware, that EngenderHealth's vision is a gender equal world. And we continue to identify, continue to address gender barriers in the community, wherever we work. You also must be aware that we are working in Sitamarhi district of Bihar with the support of Packard Foundation, where we are providing technical assistance in implementation of the Government of India's RKSK program, that is the Adolescent Program, with a special emphasis on peer educator program. And we find that peer educators have a lot of potential. They are not only as a recipient of the services or as a client, they can also act as the big resource in the community. And we also aware that Government of India has a lot of commitment in terms of ending, child mortality. Preventable deaths of children are to be avoided. And this is not only the commitment of Government of India, even the SDGs commitment of ending newborn deaths, ending preventable newborn deaths, and even the ambitious targets have been kept. And while working in the district of Sitamarhi, we noticed that there is a significant gender differential in the child mortality in the state of Bihar. The male infant mortality in the state of Bihar is 30, and the female infant mortality in the state of Bihar is 35. there is a significant difference in the the newborn survival. And to my mind, gender is an important determinant, and we must address and we must need to address these gender differentials. That's why, what we did was, with the support of UNICEF, we identified the existing adolescent peer educators or adolescent girls as the champions. And then we oriented them in conveying simple newborn messages to the families where girl child is born. And we took the support and the guidance of the ASHA worker as well, because ASHA worker is mandated to make, visit to every child, every newborn. There are 6 visits are mandated. But looking at this gender, differential in newborn mortality, so, we added the element of, we tried to engage, meaningfully tried to engage adolescent girls as champion in terms of conveying simple newborn messages. And during this, 2 months initiative, we oriented around 1,005 adolescent girl champions and 531 newborn girl families in 8 blocks of Sitamarhi. They were visited, and the newborn messages were conveyed along with the handouts. And we also engaged with the local leaders. We also engaged with the parents, and we took care of this basic principle of, no harm framework, which is very critical whenever you want to do any activity in the community. No harm framework was put into action, so as to avoid, any kind of a backlash from the community. And, if you look at the results are so encouraging and satisfying, that we find that the adolescents have the potential to be a real change agent in the community for addressing any problem in the community, any public health issue in the community. So they can be true change agent. And we also interviewed around 405 adolescent girl champions, and we recorded their observations. And interestingly, we find that 90% felt very confident in conveying the newborn messages. And even the same number, around 89-90%, also felt that their own knowledge has also improved, which will have a long-term impact in their own health and the well-being of their own and their communities. And they also indicated they have understood the gender barriers in the community and encouraged people not to do a kind of a discrimination between a male and a female child. This is a real example of a community taking the ownership in addressing those gender barriers, the gender differentials. Therefore, it appears that adolescents have the real potential to take leadership role in the community. So with these few words, I stop here. And now I will request Priyanka, if you can, show that film, which we have captured, which captures the journey of this complete initiative. Thank you very much.
Thank you, sir. We'll just like to show you a small video of the work that we did in Sitamarhi. Thank you.
Deep in the rural heartland of North India, a group of young girls have been bringing in a unique initiative. EngenderHealth, with the support of UNICEF, implemented the Adolescent Girl Champions initiative to understand how adolescent girls in the Sitamarhi district of Bihar can be involved in supporting families for the survival and health of newborn girls. The infant mortality rate in Bihar is 32 per 1,000 live births. Gender differentials are also significant. The first month of a child's life is most crucial, with more than 2/3 of the deaths occurring during this period. Several social factors lead to neglect of health of newborn girls, and the resultant delay in recognizing signs and symptoms of illnesses and seeking treatment. Most of these deaths are preventable. EngenderHealth's initiative focused on survival of newborn girls in 8 blocks of Sitamarhi district through the engagement of adolescent girl peer educators as champions to enable and equip families for healthy growth and development of newborn girls. It intended to work towards improved newborn care practices and knowledge in the community with a special emphasis on girl child to address gender differential in newborn care. Improved knowledge of essential newborn care among adolescent girl champions. Improved understanding among adolescent girl champions of gender barriers that impact the care of newborn girls. The initiative utilized the gains made as part of the TARUNYA project in the district and built capacities of the project's adolescent peer educators to engage them meaningfully as champions in the selected blocks. The adolescent girl champions were selected and trained in careful consultation with key stakeholders in the village, including mentors and frontline functionaries such as ASHAs. They supplemented the efforts of ASHA workers, who are mandated to conduct home visits to all households with newborns. The project was continuously monitored through mentors and field staff of EngenderHealth.
मैं पहले पीयर एजुकेटर थी, उसके बाद मैं किशोरी चैम्पियन के रूप में चयनित की गई और मुझे 1 दिन का ट्रेनिंग मिला गया। मुझे फिर ट्रेनिंग में 6 विषय के बारे में बताया गया, जिसको मैं फिर होम विजिट करके और माँ और उनके परिवारों को भी बता रही हूँ।
Implemented over a period of 2 months, the initiative has helped create a girl-child friendly, informed, involved and gender-equitable environment for the healthy survival of newborn girls. At the center of this change stands a girl herself, as the confident adolescent girl champion.
जब से ये बच्ची लोग आई हैं इसमें ना, तो बहुत अच्छा ये लोग काम कर रही हैं। हम लोग को लिए, हम लोग के हित में बहुत अच्छा काम लेके हम दोनों मिल करके समझाते हैं। बहुत अच्छा ढंग से अब समझ ली है। आई लड़की जाती है ना, हमसे ज़्यादा ही समझा लेती हैं।
रूपा नाम की लड़की आई थी तो मेरे बोले कि इसे अच्छा से रखने के लिए, गीले कपड़े में उसे नहीं रखने के लिए, गर्म कपड़े में रखने के लिए, छाती से उसे चिपका के रखने के लिए, इसे साबुन लैट्रिन उटिंग करे तो उसे साबुन से हाथ धो के रखना चाहिए, उसे इसे नहीं रखना चाहिए।
Music echoes, good music echoes further. Block by block, district by district, world by world. The song of success scripted by EngenderHealth's Adolescent Girl Champions promises a symphony of healthy living for many more newborn girls as new frontiers, new hopes beckon.
Thank you, everyone. And for those who were not able to see the video clearly, we'll be posting the link of the video. It's on the EngenderHealth website. And thank you, Dr. Khera, for setting the context of this interesting conversation and giving a glimpse of this unique initiative. My next speaker is a young person herself, a leader, a thought provoker, and a strong advocate for meaningfully engaging with adolescents and youth across the program structures, processes. Ana Aguilera. She leads EngenderHealth's adolescent and young people's global portfolio and supports the integration of gender, youth, and social inclusion into everything that EngenderHealth does. I welcome Ana to share her experience of working with young people globally and engaging them meaningfully. Welcome, Ana. Over to you. Thank you.
Thank you, Priyanka. Welcome to everyone who is joining us from all around the world, especially in India. My name is Anna and I work at EngenderHealth, as Priyanka has said. I work across our teams, our countries, our programs to do 2 things. The first is to better reach adolescents and youth with sexual and reproductive health high quality programs. And the second, and I think most important, is to better work with adolescents and youth across what we do, whether it's our programs, our processes, our structures, to elevate their voices, their participation, and their leadership. with a special emphasis on the participation and leadership of adolescent girls and young women. I remember when I was an adolescent myself, when I was working on different youth leadership programs, I remember being told that I had to be extra careful. And there were certain things that I couldn't do that some of the boys that I worked with could do, like staying past dark or maybe doing things that seemed a bit improper for girls to do. And it's lived experiences like mine that are the basis for why we at EngenderHealth focus on this integration of a gender, youth, and social inclusion lens, because we want to really identify, challenge, and ultimately change the underlying gender, age, and related biases, prejudices, and stereotypes that really hold adolescents and girls back. Adolescents and youth in general, but especially adolescent girls and young women. So here at EngenderHealth, we work on a wide range of sexual and reproductive health programs. And just a few examples. In West Africa, we work with youth bloggers, with activists, with young feminists to elevate their voices and disseminate high quality youth-friendly information about their sexual and reproductive rights, and specifically increasing access to comprehensive abortion care. In Ethiopia, we work with in and out of school adolescents and youth to deliver gender transformative and youth transformative comprehensive sexuality education so that young people are informed and have the ability to make decisions about their sexual and reproductive health. And in Tanzania, we engage youth-led formal and informal networks to tackle gender-based violence by addressing those root causes and supporting young people in building their soft skills and their hard skills to pursue educational and economic opportunities. So this project here in Bihar, the Adolescent Girl Champion project, has really demonstrated the potential and the power of adolescent girls. And by moving past seeing adolescent girls as beneficiaries or targets of programs, and really seeing them as agents of change, as Dr. Khera has mentioned, agents of change for themselves, for their peers, for their families, for their communities, and strengthening the current and future potential of our communities. Often we hear that young people are the leaders of tomorrow, when the reality is that with the right support and an enabling environment, young people are the leaders of today and tomorrow. And if we fundamentally believe that adolescents and youth are experts in their own lives, then it's our job to do everything we can to shift those inequitable power structures that we know are in place. And these structures show up within our own nonprofits, within our donor institutions, within our government structures, and they undermine the voice, the agency, and most importantly, the power of adolescent girls, young women, and adolescents and youth more generally. So this project is really a first step towards that direction, and I'm really thrilled that everyone is joining us today to learn more about it. And thank you for your time, and I'll pass it back to Priyanka.
Thank you, Anna. Thank you so much for underlining what we were just discussing, that there's a need to believe in the power of adolescents and youth, and how adolescents can be champions and change makers for their own families, their peers, their communities, everybody. Thank you, Anna. And I now welcome our next speaker, who needs no introduction, but still, Mr. Luigi, who is the Chief of Health, UNICEF India. Luigi has worked for 20 years in the international development sector, contributing to design, implementation, monitoring, evaluation of health policies and programs in many countries in Africa and Asia. Today, Mr. Luigi would be highlighting a very interesting approach of reducing gender disparities in the community through engagement of adolescents, especially for newborn girls and young children. Over to you, Luigi. Welcome.
Good afternoon. Thanks a lot, Priyanka, for this introduction. I'm not sure about your statement about not needing introductions, but anyway, thanks a lot for that. And on behalf of UNICEF, of our entire team at UNICEF, we really wish to welcome everyone here and to congratulate everyone at EngenderHealth for embarking in this initiative, and also to express a word of thanks to Dr. Zoya on behalf of the Ministry of Health and Family Welfare for being here. We know how much Dr. Zoya is an engine, a powerful engine of change, And so I hope that by listening to the learnings that we will go through today, some ideas will come that the Ministry of Health and Family Welfare can take forward. I just want to share a few words. Of course, in a previous life where there was no COVID and Dr. Khera was in another capacity, I learned, and today I had the confirmation, that coming on any panel after Dr. Khera means that the job is done already and nothing has been left to say. With the opening from Dr. Khera and also the very powerful images that came through the video, which I hope we are allowed by EngenderHealth to upload on our website at UNICEF. But anyway, coming after this and after Anna, I just want to bring a few thoughts. I will start from 3 points about a concept where I really see value here, that is rights, human rights and child rights in particular. And here I think this initiative is talking to three fundamental rights of the Child Rights Convention. One is the right to life, which every boy and girl has invariably, even before conception, and therefore any action that can be done to protect it is speaking to a universal right. The second is right to health and healthcare. And we know from data that healthcare has biases in some regions of India when it comes to access to it or referral to it due to gender reasons. And the third, which is maybe a less known right of every child, and let me remind everyone that by child, universally, we talk of anyone below the age of 18, is the right to participation. So children have the right to be heard and to participate. And again, this initiative gives the possibility to the adolescents to participate to social life and to social improvements. And therefore, three very important points in terms of looking at this initiative from a rights-based perspective. Mirroring this, another 3 points looking at this initiative from an equity-based perspective. Here we're talking of Bihar. If we match the ratios of mortality with the population of Bihar, it's clear that the toll of a newborn and infant mortality in the state is one of the highest in India, and probably is a good pie of the entire mortality for newborns, at least across the globe. So a zoom in a very difficult state, which is striving and trying to improve, is a very much welcome initiative in terms of equity. The other is on girls. We know that newborn girls have, biologically speaking, a higher chance of survival than boys. So not only girls are smarter than us across the board, but also biologically, they have this, and this is proven globally by numbers, by statistics. And yet, as we go through the life course from newborn to post neonatal life of boys and girls, we see that in India and in Bihar in particular, the ratio that one would expect as per global statistics is magically or dramatically inverted. And that doesn't speak to a different biology. It speaks to communities, to behaviors, to beliefs, and to culture. And who better than the youngsters, and in this case, the adolescent girls, can be an agent of change. The third is the adolescent girls themselves. If we invest in these girls, and I've seen some on screen, I look forward to hear from them. We do 3 things, 2 or 3 very important things. We change immediate outcomes in the community. We educate the mothers of the future, and we probably guarantee a better survival for the children of the future. And that's not my opinion, that's the Lancet. So a third point that I would like to highlight, and the last, about what excites us about this initiative, is more around the approach that has been taken. And again, 3 considerations here. One is an approach that clearly looks at primary healthcare And COVID-19 has clearly taught us how much primary health care is fundamental. And there are a couple of usual misses in our approach to primary health care. We all talk primary health care, but doing it in a proper way means also a few things that we not always realize or not always do. One is fully engaged communities in delivering and then making judgments or assessment, evaluating the care that they receive. And there is nothing better than an involvement of the adolescents here. The second point is of PHC that, again, here we're looking at is care is not only about care, it's also about prevention. And here we're really looking at this aspect of early detection, prevention, to avoid the issues before it's too late. The other nice thing about the approach is innovation. I think often we think of innovation in terms of the newest app or the newest tool or the newest gadget. There is also social innovation, which is about how differently you can do things with the same ingredients, cook a different recipe and make it nicer. Which I think this speaks about small scale, 2 months. By all means, we're still in breastfeeding stage, very early stages, but it means trying to use the power that we have within the community for better outcomes. And the very last point, and I'll stop it here. This year, 2021 is the year declared globally by WHO as the year of the healthcare workers. And I always like to think, being in this very awkward position of being the chief of health in a global organization, but not a medical doctor, that healthcare workers are heroes in all what they do, particularly in low and middle income countries. And if we look at what healthcare workers did last year, then I think they became superheroes, not only heroes, for all what they've gone through. And in that, looking at the video, when I see we all talk about task shifting and moving, reducing the burden and the pressure on the health workforce, when I see these young girls releasing some pressure from the ashes who have thousands of other life-saving things to do, I think we're also giving a wonderful additional weapon to bring about education in community, but also to support the frontline workers in doing a bit more and a bit more efficiently by tapping into the power and the strength that they have there in their communities through young people that can be easily educated. Of course, they cannot do everything, but they can be an extra voice, adding to the game of behavior change, health promotion, and similar activities. So I'll close it here just as a reminder. There is a study out there through which someone has looked at, I think, 144 countries and looked at what have been in the past 20 years the major determinants in these 140 plus countries of the reductions observed in child mortality and in maternal mortality. So this is global. And it will be of interest to you that only 20% of this reduction is attributed to changes within the health sector. Most of it comes by changes into education, gender, behavior, economic status, infrastructure, and the likes. Again and again, there is more that can be achieved out of just delivering clinical care, but reaching out to communities as agents of change. Thanks again for this, that I would hope is just a start of a longer journey in terms of scale and duration, and I look forward to the rest of the deliberations. Thanks to all of you.
Thank you so much, Luigi. That was inspiring. And Thank you for highlighting very, very important points here. The right to participate by the adolescents, and talking about, young people as agents of change, and for the better survival, and engaging fully with all the communities, which is actually now the key to, if we are actually wanting to make a change in the health determinants for a while. And I think one very important point that you actually talked about in your concluding remarks, that, only 20% of it is coming from within the system, and how useful, or how this approach of engaging young people can be an interesting approach. And yeah, yes, thank you, Luigi. And now this is a time, let us meet our real life champions who have made this all possible. For me personally, every time I meet these champions, I'm so inspired that it makes me believe in their power even more. So we have structured this session as a QA session so that we are able to bring to you the experience of these AGCs in the limited time that we have. And our AGCs will be talking in Hindi, and I'll try my best to translate in English. Pardon me if I miss out something. Please do point out in the chat that this point got missed, which was very important. So let me welcome our champions. So here they are. Welcome Muskan, Rupa, Alka. इतने सारे लोग आपसे जुड़े हैं, आपको सुनने के लिए आज। क्या आप सबको अपना परिचय देना चाहेंगे?
Yes, ma'am.
Yes, please, Muskan.
Good evening, ma'am. I'm Muskan, peer educator, AGCs, Adolescent, age 17, district Sitamarhi, Bihar.
Thank you.
Everyone,
Rupa.
good evening. Everyone, good morning. मेरा नाम रूपा कुमारी है. मैं एक peer educator and किशोरी चैंपियन हूँ. मेरी उम्र 19 वर्ष है. ब्लॉक डुमरा, जिला सीतामढ़ी, स्टेट बिहार से.
Thank you. And Alka.
I am Alka. I am a peer educator and AGC. My police station Diga, my district Sitamarhi, my Anganwadi center code 134 और age 18.
Thank you. अब मेरा पहला प्रश्न, so I'll be posting the questions in the QA chat box so that you are able to read what I'm asking them. So मेरा पहला प्रश्न आप लोगों से होगा, कोई भी जवाब दे, आप इस पहल AGC के रूप में आप कैसे शामिल हुए? कोई भी जवाब दे, मुस्कान, रूपा, अलका, कोई भी. So I'm asking, like, how did you join this initiative?
जैसे मैम मैं पहले पीयर एजुकेटर थी. उसके बाद मैं मतलब जो हमारे सीनियर्स हैं और जितने भी इसके मतलब जो कार्य करते हैं, तो उसने मतलब सोचे होंगे कि कहीं न कहीं ये जानकारी जो है नवजात शिशु को कैसे देखरेख करना चाहिए, ये जानकारी क्यों ना हम किशोरियों को दे कि ये जानकारी उनके लिए भविष्य में भी अच्छा होगा और प्रेजेंट में भी अच्छा होगा. इसीलिए हम लोगों को एक दिवसीय ट्रेनिंग दे करके इसमें शामिल किया गया और हम लोग इसमें शामिल होकर बहुत खुश हुए हैं.
ओके, थैंक यू. मुस्कान, मैं इकट्ठा ट्रांसलेट कर दूंगी बाद में. मुस्कान, अलका, आप कुछ ऐड करना चाहेंगे?
यस मैम. और इससे पहले जैसे आरकेएस के प्रोग्राम से हम लोग एक पीयर एजुकेटर है, तो वहाँ हम लोग अपने एज के लोगों को बताते हैं और यहाँ हम लोगों का एक ऐसा प्लेटफॉर्म मिला जहाँ हम अपने से बड़े एज के लोगों को बता सकते हैं. और एक लड़की होने के नाते किसी लड़की की लाइफ को बचाना हमारे लिए बहुत बड़ी अपॉर्चुनिटी है और इसमें हम लोग अच्छे तरीके से करेंगे ताकि किसी लड़की की लाइफ को बचाया जा सके. अगर हर लड़की बचेगी तो इसमें हम भी एक लड़की है और वो हमारे लिए भी बेनिफिशियल होगा.
थैंक यू. अलका, कुछ जोड़ना चाहेंगे?
यस मैम.
बोलो.
मैम के माध्यम से मालूम हुआ कि एक मतलब नवजात शिशु को बचाने के लिए एक प्रशिक्षण होने वाली है. वो प्रशिक्षण के संबंध में जानकारी के लिए एक प्रशिक्षण होने वाली है.
उस प्रशिक्षण के होने के बाद लोगों को अपने समुदाय में जाकर इस जानकारी को पहुंचाना है और नवजात शिशु को कैसे सुरक्षित रखना है इसके बारे में प्रशिक्षण में बताया जाएगा। अगर हम अपने समुदाय में अपने शिशु को, अपने नवजात शिशु को बचाने के लिए ऐसे प्रशिक्षण में क्यों नहीं भाग लेंगे, जरूर लेंगे।
So just to translate, Rupa says that she was previously a peer educator where she came to know about this initiative that is being taken up, and this is how she got to know. And Alka adds that when she got to know about this initiative, she was like, if I am getting a chance to affect newborn lives, why wouldn't I participate? And Muskan makes a very interesting point. She says that I am a girl here and I'm getting an opportunity to save a girl. And if she's getting this opportunity, if a girl is coming forward to help a girl, this is going to be like a benefit for the broader community. So this is how she thinks that, it has been beneficial for her to join this initiative. मेरा अगला सवाल आप लोगों से होगा कि एजीसी के रूप में आपने अपने अनुभव में कुछ नया सीखा इस दौरान एजीसी बनने के बाद?
एजीसी बनने के बाद हम लोगों ने अपनी अनुभव से बहुत कुछ सीखा। एक तो न्यूबॉर्न बेबी केयर के बारे में, किस तरीके से बच्चों का केयर करना। फिर हमारे समाज में सबसे बड़ा जो भ्रांति होता है कि लड़के लड़की में जो डिफरेंस कर दिया जाता है, कि अगर लड़का होता है तो वो चीज मतलब शुरू से लास्ट तक लड़कियों के साथ होता है। अगर कोई औरत जैसे प्रेग्नेंट रहती है तो वहां पे उसके अंदर ये एक्साइटमेंट रहता है कि वो अल्ट्रासोनोग्राफी करवाती है। अल्ट्रासोनोग्राफी होता है जो कि बच्चे की सिचुएशन को देखने के लिए, बट लोग यहाँ जेंडर चेक करने के लिए अल्ट्रासोनोग्राफी करवाते हैं। और अगर लड़की हुई तो उसका एबॉर्शन करवा देते हैं। बट अगर अल्ट्रासोनोग्राफी में नहीं भी पता चला तो लड़की के केयर में भी डिफरेंस करते हैं। फिर उसके बाद उसकी एजुकेशन होती है। तो लड़का है तो उसको बहुत अच्छा हायर एजुकेशन देने के बारे में सोचते हैं। फिर मैरिजेबल एज में जाने के बाद फिर लड़का है तो वो जॉब करेगा, उसके बाद उसकी शादी। अगर लड़की है तो उसकी शादी कर देना है। ऐसा सब हमेशा लड़कियों के साथ होता है। और घर में भी ये हमेशा बोला जाता है कि लड़की हो तो लड़की की तरह रहो। ऐसा सब कुछ लड़कियों को झेलना पड़ता है।
Okay, let me translate before I forget everything. So Muskan says that one thing that she learned after joining this initiative was definitely about newborn care. And also what Muskan says is that this gave, actually she always knew that, but then kind of it reiterated the gender disparities that exist, even, like when a woman is pregnant, so many people go for abortion because we all know about sex discrimination in our society. And then there is discrimination at all levels, whether it's education, nutrition. So even when a boy turns 20, there's still a scope for him to go and work and do stuff which he wants. But then for a girl, the only solution that she thinks in her community is marriage. Yes, रूपा, आप कुछ और ऐड करेंगे?
यस मैम, जैसे हमारे समाज में ये भी देखा जाता है कि जैसे हम लड़की है तो जैसे बाहर नहीं पढ़ने दिया जाता है। जैसे लड़की है तो तुम घर में खाना बनाओ, बस बहुत हो गया। बाहर तो एकदम मतलब नहीं जाने दिया जाता है। जैसे लड़का है तो बाहर पढ़ेगा, आईएएस ऑफिसर बनेगा, लेकिन लड़की है अरे तुम पढ़ के क्या करोगी, खाना बनाना है, बस ये हो गया। और सबसे बड़ी भेदभाव तो ये देखा जाता है मैम कि जैसे जब लड़की गर्भ अवस्था में रहती है, गर्भवती जो महिलाएं होती हैं, तो उनको तो सबसे बड़ी बाधा ये होता है कि पौष्टिक आहार भी नहीं दिया जाता है अच्छे से। जैसे लड़कों को पौष्टिक आहार जरूरी नहीं है उतना, फिर भी दिया जाएगा, लेकिन यहाँ ये नहीं देखा जाता है कि जैसे हमारी बहू या हमारी बच्ची जो है वह गर्भ अवस्था में है, उन्हें पौष्टिक आहार की जरूरत है, लेकिन यहाँ तो ये भी मतलब नहीं कर पाते हैं। जैसे लड़की है तो रूखा सूखा कुछ भी खा ले गर्भ अवस्था में भी, जबकि न्यूट्रिशन सबसे जरूरी चीज होती है गर्भ अवस्था में, ताकि हमारे बच्चे आगे भी स्वस्थ रहे और जो भी शिक्षा का या जो भी कैरियर हो अच्छे मतलब बच्चे हो। तो ये कमी न्यूट्रिशन में भी ज्यादातर देखा जाता है हमारे समाज में।
यस, थैंक यू। तो
एक पॉइंट और देखा जाता है मैम, एक पॉइंट और ये भी देखा जाता है कि जैसे हम लड़की हैं तो खुलकर अभी भी लड़की समाज में बात नहीं करती है। जैसे अपने माँ से भी खुलकर सारी बात नहीं कह पाती है। अभी ऐसा मतलब ये चल रहा है लड़कियों के प्रति। लड़का है तो उसको बस खुली मतलब पैसा दिया जाता है, हर सुविधा दिया जाता है, गाड़ी दिया जाता है, लेकिन लड़की को क्या, जैसे घर में कैद रहना है, बस हो गया। और दूसरा तो बाल विवाह होता है, बाल विवाह कर दिया और तुरंत बच्चे हो जाते हैं, तो इसका भविष्य में बहुत थोड़ा सा गलत ये आता है रिजल्ट। तो ये सब नहीं होना चाहिए मैम, ये हमारे समाज में एक बहुत बड़ी भ्रांति है। तो हम चाहेंगे कि इसको दूर करेंगे, और दूर तभी होगा जब हम सब गर्ल्स एक होंगे, तभी ये समस्या का हल हो पाएगा, अन्यथा नहीं हो पाएगा। हमारे गवर्नमेंट ने भी कानून बना रखा है, लेकिन कोई मानने के लिए तैयार नहीं है। तो हम लड़कियों को सजग रहना होगा, तभी ये इसका हल हो पाएगा मैम।
Thank you, Rupa. So Rupa says again, I agree. I really cannot actually translate the enthusiasm with which she talks, but I'll still try. Rupa says that again, these disparities, they exist at all levels, whether it's nutrition or whether it's education. Even, for example, if it's a pregnant woman and we all know that she needs additional care, additional support, but that still doesn't happen at the community. We all know that the biases are so prominent in the community. And then she says that the solution to address all this is that, you know, if as women or as girls, we come together and talk about this as a, you know, as one body, as one people. So there are laws, child marriages happen, and so there are laws, but then as my AGC says that they really aren't as effective as they should be. Alka, कुछ और आप ऐड करना चाहेंगे? जी अलका,
क्वेश्चन का रिपीट थोड़ा।
हाँ, मैं यही पूछना चाह रही थी आपसे, जो हम लोग अभी बात कर रहे थे, आपने नया क्या सीखा AGC बन के? और एक and I just Alka, एक second, and I think I missed one point from Muskan, that she highlighted that initially when she was a peer educator, what she was doing was talking to young people of her own age, because as a peer educator, you are supposed to make groups and talk to other adolescents. But with this initiative, what she did was to go out in the community, talk to people who are adults, who we know how, you know, in India, it's age does matter. So this actually gave her opportunity to do this. जी अलका, sorry मैंने आपको interrupt किया, कुछ और ऐड करेंगे आप?
जी मैं तो ऐसे बहुत ज़्यादा सीखा, लेकिन 2-4 टॉपिक यहाँ पे बता दूं, क्योंकि समय भी यहाँ पे बहुत कम है ना। मैं तो अपने वो पहले तो नवजात शिशु को कैसे सुरक्षित रखा जाए इसके बारे में अच्छी तरह से जानकारी, उसके बाद अपने समुदाय तक मतलब जाकर उनके व्यवहार को, उनको जानकारी को समझी, और अपने पूरे मतलब समुदाय में अपने से बड़ों के बीच अपने बातों को रखना, ये बहुत मुमकिन है मैम।
Right. जी, तो अलका भी कह रही है कि एक she got information on newborn care, then she got the confidence to talk to adults in her own community, and, you know, being able to communicate what she has learned in the training. And there are a lot of interesting questions coming from the AGCs. I'm so excited. So I'll just ask one more question, because that question answers some of the questions that you're asking. मुस्कान, प्रिया और अलका, आप लोगों के लिए इतने सवाल आ रहे हैं मेरे पास, लोग आपसे इतनी बात करना चाह रहे हैं। जस्ट एक और क्वेश्चन, कुछ लोगों के आंसर उससे हो जाएंगे। मेरा आपसे प्रश्न था कि क्या आप ऐसे इनिशिएटिव्स में, ऐसे प्रोजेक्ट्स में दोबारा जुड़ना चाहेंगे? मैं इसलिए पूछ रही हूँ, आपको स्कूल भी जाना है, आप कोचिंग भी जा रहे हो, आपको घर के काम भी करने हैं, आपको लगता है कि ऐसे इनिशिएटिव्स में आपको जोड़ना चाहिए? और क्या ये चीज और बच्चों, लड़कों और लड़कियों दोनों को आप ये रिकमेंड करोगे? और अगर करोगे तो हमारे जैसे लोग जो इस पैनल पे बैठे हैं, जो आपको सुन रहे हैं, हम आपकी कैसे सहायता कर सकते हैं उसमें?
हम जुड़ना चाहेंगे, क्योंकि अगर ये प्रोग्राम जितना आगे बढ़ेगा, और ये बहुत बड़ा मैटर है जिसको मतलब संभालने में बहुत टाइम भी लग सकता है, और अगर ये रेगुलर रहा तो ये पॉसिबल है। और जैसे हम लड़कियों को ट्रेनिंग किया गया, इसी तरीके से बॉयज पीयर एजुकेटर को भी ट्रेनिंग किया जाना चाहिए, क्योंकि किसी भी घर में इन सारी चीजों के पीछे एक लड़की का ही हाथ होता है। और अगर कोई सारी बातों को समझेगा, तो जैसे हम लोग बच्चे की माँ से जाकर बात करते हैं, उसी तरह से वो बच्चे के पापा से भी जाकर बात कर सकता है और उसको बता सकता है कि ऐसा कुछ भी नहीं करना चाहिए, बॉयज गर्ल्स दोनों इक्वल, अगर इक्वल उसको एजुकेशन दे, इक्वल अगर उसका केयर करे, तो फिर कुछ भी कम नहीं है और हर कुछ पॉसिबल है।
So Muskan says that initiatives like this might take time to, show results, but then they are good, promising things. And she also highlights a very important point that boys, peer educators or boys or adolescent boys or young boys should also be involved in initiatives like this, because they also have the potential to talk to a father or, somebody else in the family about these issues. Anything, Rupa, or आप कुछ ऐड करेंगे?
यस मैम, जैसे मेरा कहना है कि जैसे हम इसमें दोबारा भी शामिल हो सकते हैं, जैसे कि हमारे समुदाय में एक आंगनबाड़ी केंद्र होता है या कहीं कोई ऐसा जगह होनी चाहिए जहाँ पे 10-5 लोग बैठते हैं या बातचीत करते रहते हैं। तो वहाँ पे ऐसे हम ज्यादातर करके आंगनबाड़ी केंद्र का बात करेंगे, क्योंकि वहाँ एक मतलब सब जगह है, अच्छी जगह होती है। तो वहाँ पे हम चाहेंगे कि हमारे समाज के या हमारे जो मोहल्ले की जितने भी किशोरियां हैं, जैसे हम किशोरी चैंपियन हैं, तो हमें तो ये जानकारी पता है कि बच्चे को कैसे देखरेख करना है, गर्ल को बचाना है, ये चीजें मुझे पता है। लेकिन हो सकता है कि जो लड़की, जो किशोरियां नहीं पढ़ने जाती हैं, स्कूल अभी तक नहीं गई है किसी कारणवश, तो हम चाहेंगे कि क्यों ना उसको भी इसमें शामिल करके उस आंगनबाड़ी केंद्र पर उनके जैसे पेरेंट्स वगैरह भी मतलब आ जाएंगे और लड़की खुद भी आ जाएगी, तो ये जानकारी उसे भी हो जाएगी। जैसे वो स्कूल नहीं गए, उसे किसी कोचिंग या किसी संस्थान में उस चीज का जानकारी नहीं मिली, तो हम चाहेंगे कि क्यों ना एक प्रोजेक्टर के माध्यम से या हमारे कुछ सीनियर्स हमारी सहायता करेंगे, जैसे हमारे ANM दीदी हो गई, आशा कार्यकर्ता हो गई, आंगनबाड़ी सेविका, तो जैसे काउंसलर दीदी हो गई, तो ये सब का सपोर्ट हम चाहेंगे। और भी जो सीनियर्स लोग हैं उनका भी सपोर्ट हमें अगर मिलेगा तो ये भविष्य में कुछ आगे तक ये पहल चलेगी और कभी न कभी एक न एक दिन ये जो गर्ल्स वाली जो सिस्टम है वो खत्म हो जाएगी और भेदभाव भी खत्म हो जाएगा। ऐसे जैसे कम्युनिटी या हमारे समाज के जो भी बच्ची हैं जो अब इस चीज की जानकारी अभी उसे नहीं पता है कि ये सब क्या होता है, और जो लड़की पढ़ रही है उसको तो पता है ऑलरेडी कि ऐसा होता है, फिर भी वो करते हैं। लेकिन जब पेरेंट्स इस बात को सुनेंगे तो वो ज्यादातर एक्शन लेंगे, क्योंकि मतलब जैसे भ्रूण हत्या ही करवाते हैं तो परिवार वालों की इसमें ज्यादा सपोर्ट होता है, वही सिखाते हैं कि यार भाई मार दो बेटी को, क्यों बेटी क्यों होगी। लेकिन हम सब ये सोचते हैं कि अगर बेटी नहीं रहेगी तो फिर बेटा कहाँ से आएगा, बेटा में तो बीमार नहीं हो सकता है, तो क्यों ना हम इस चीज को बदल दें। तो हम चाहेंगे एक जैसे संगठन के माध्यम से इसको और आगे तक पहुंचाए और सभी इसका लाभ उठाए।
Thank you, Rupa. Thank you. Really, I cannot. हाँ जी रूपा, बोले।
आम सभा के तौर पे जैसे हमारे जो मुखिया होते हैं गांव का, जैसे कुछ लोग जो होते हैं राजनीति के तौर पर, तो उन लोग का बात का कुछ ज्यादा ये होता है। ऐसे तो कानून भी बनाए गए हैं लेकिन उतना कौन समझता है। अगर पेरेंट्स इस बात को सुनेंगे तो हमको लगता है कि एक्शन लेंगे, थोड़ा सा कोशिश तो जरूर करेंगे, एक्शन लेंगे, कोशिश करेंगे।
Thank you, Rupa. So again, मैं फिर कहूँगी, I am really not able to translate the enthusiasm with which these girls are talking. But what Rupa says is that she starts by saying a very interesting point that she goes to school, she goes to coaching center, and she still, from her involvement in the school, she gets to know some, have knowledge on some issues around, maybe it's SRH or maybe newborn care or, issues that actually affect her daily life. But then there are other girls in the community who have never been to school, who really do not get an opportunity to go to school. So, platforms should be created that she gives some examples like Anganwadi centers, ANMs, and people like counselors, Anganwadi centers, or PRI members of the community. They should come together and, we should be able to create a group of girls, young girls or women together who are able to actually talk about these things. So that the girl, any and every girl in the community has this kind of knowledge. And she says that it's very important, and she is aspirational, of course, hopeful, yes, but she is also practical when she says that she is very aware that these things might not happen over a period of time, and that this is going to take a time. And she reiterates that if the community has to keep on to flourish. You know, a boy comes from a girl's, a literal translation of what she says, then I think the girl has to, all women have, or the girls have to be given this kind of knowledge. Alka, आप कुछ ऐड करना चाहेंगे? जी जी जी।
हम लोग को मतलब प्रशिक्षण दिया जाए जिसमें नए नए विषयों की मतलब जानकारी मिले। उस जानकारी को हम अपने समुदाय के ऐसे किशोरी को बताएंगे जो आरकेएसके से ऐड ना हो।
Ji. So she says ki RK, because as you all know that under RKSK only 2 peer educators per village are selected, and they you know, form groups with other adolescents in their community. So she says that with this kind of knowledge, she will be able to reach out more girls like her. So I think how much time do we have? Some I found a very interesting question here, which I think should be taken to the girls. And आपसे कुछ लोग पूछना चाह रहे हैं कि आपको जब कम्युनिटी में गए तो आपको सीनियर ओल्डर जो लेडीज थी या मदर इन लॉस थी या मदर्स थी, उनसे रेजिस्टेंस आया? रेजिस्टेंस माने कि उनसे लाइक आपको सपोर्ट मिला या आपको थोड़ा सा दिक्कत हुई शुरू में? जी रूपा प्लीज।
मैम पहले तो हम जैसे वहाँ विजिट करने गए, बच्चों को, नवजात शिशु को देख करने गए, तो वहाँ तो सबसे पहले महिलाएं जो थी या बच्चे की माँ थी, तो सबसे पहले ये प्रश्न हमसे किया कि इससे इस फोटो खिंचवाने से, ये सब समझाने से क्या होगा, कुछ बेनिफिट मिलेगा? लड़की है तो कुछ सरकार के द्वारा मतलब दिया जाएगा इसके तहत? हम बोले कि अरे पहले मेरी बात को सुनिए। तब जब हम इस शिक्षा सब्जेक्ट के बारे में बताए तो तब जा करके वो थोड़ा सा रिस्पॉन्स लिए, और उस दिन तो उतना रिस्पॉन्स नहीं लिए जितना लेना चाहिए, लेकिन नेक्स्ट दिन जब हम गए तो हमारे बातों को वो लोग ध्यानपूर्वक सुन रहे थे, और मोहल्ले की एक 2 महिलाएं भी थी, वो भी इस चीज को सुन रही थी। तो ये चीज
थैंक यू। तो मुस्कान कुछ और ऐड कर रहे थे आप? हाँ जी प्लीज।
जैसे तो वो विजिट करवाने जब फर्स्ट टाइम गए तो सबसे पहले तो ये बोला गया क्या हमने भी तो बच्चे पाले हैं, हम लोग भी ऐसा कुछ किया है। गवर्नमेंट बस यूं ही किसी भी तरह के प्रोजेक्ट पे बताते हैं, बट क्या हम लोगों को कोई इकोनॉमिकल सपोर्ट, इन सारी बातों पे भी पूछा गया। जब उनको बताए तो इन सारी बातों को फिर वो फॉलो भी करने लगे। और जैसे उन लोग पहले करते थे कि गोबर टच किए, फिर उसी हाथों बच्चे को टच कर लिए, और जैसे बच्चे को दूध भी पिलाना बोलते थे, दिन भर पिलाते थे, पर फिर उन लोग बात का रिस्पॉन्स लेने लगे।
Thank you. So Rupa says ki initially when she started giving these messages, there was some reluctance, and the most important question asked was there that what incentives I am going to get. But eventually when they were able to talk to them with confidence, people started listening to us, and this is what Muskan reiterates, that again people ask that, you know, government keeps on bringing such initiatives all the time. So what are we getting new here? So but then eventually they were able to convince them. I have a lot of questions, but I really don't have time. I'm sorry, but we assure that we will reach out to the AGCs with your questions and would get back to you through email or whatever email you have registered with proper answers to whatever you have asked. Thank you so much. Thank you, Muskan. Thank you, Rupa, and thank you, Alka. तुम inspiration हो हम सब के लिए. And please keep on doing. जो कर रहे हो अच्छा वो करते रहिएगा. Thank you so much. Now moving on to the rest of the webinar. This was a very interesting session for me, and I think it is truly wonderful to hear from our champions being able to share their experience and listen to their stories. And now this brings us to our next speaker, Mr. Anand Sinha, who is the country advisor for David and Lucille Packard Foundation in India. Anand Sinha has over 28 years of experience in public health, primarily related to reproductive, maternal, child health in India. And he's a strong advocate and thought leader on adolescent issues in India. Anand will talk about foundation's priorities in adolescent space and further about the possibility of using peer or champion-led approaches to address health and wellness needs of unreached adolescents. Over to you, Anand.
Thank you so much. Luigi was saying that it's a hard act to follow when Dr. Khera has spoken. It's an impossible thing to follow after you've heard Alka, Rupa, and Muskan speak. And frankly, I'm going to bore everyone because the highlight of the show has happened. We can go home. It's very hard to follow. Alka, Rupa, Muskan, अगर हम लोग webinar में नहीं होते और अगर हम लोग face to face होते, एक room में होते, तो अभी सब लोग ऑडियंस में खड़ा होके आपको ताली बजा रहे होंगे, क्योंकि आपको सुन के और आपको देख के सबको एक जोश और एक एनर्जी मिल रहा है. Just to translate, I'm telling Muskan, Rupa, and Alka that if we weren't tied up in this Zoom format and if we were in a room, we would all be giving them a standing applause right now. That's frankly what they deserve for the work that they do and the way that they have conveyed it to us. This is just so wonderful to hear. Thank you. So I'm going to try and keep my comments short. You know, the Packard Foundation has been committed and has been working on issues related to adolescent health for over 20 years in India. Our partnership with EngenderHealth goes back more than a decade, working on issues related to adolescent health. It's partially because we think that the issues of adolescence are important, but it's also very much because the issues related with adolescence are some of the hardest issues that one actually encounters in the field of public health. They're one of the issues which is of the lowest priority in the field of public health, primarily because they're a very healthy population. Many people just don't consider them to be of high priority. Programming for adolescents' health is difficult. It's not just about providing a product. It's not about immunization. It's not about giving, you know, specific set of services. It's about dealing with a whole person in their growth trajectory. And I think the most important and maybe the most hardest part is that programming with adolescents comes with a lot of backlash and challenges. There's a lot of people who object to people talking to young people, people trying to inform, provide information, provide access to services, trying to sort of change mindsets is something that comes with backlash. Listening to these three young ladies, they make it look easy, but it's not. This comes with tremendous, and I know there was a lot of questions in there which were saying, what are the challenges? And I think that's really is very relevant questions, because that's often what is, you know, what really holds programs back. And I know that's what our partnership with EngenderHealth has really been about trying to explore for these last 10 years. What we're trying to do right now with EngenderHealth through this partnership is really try to figure out how do you help to implement one of the most ambitious yet one of the most complicated programs that the government of India has undertaken, which is the RKSK. It is a very ambitious program. It took a long time to conceive. It was conceived in the most, I think, you know, people always say this, it was a beautifully written document. It's really well written. But when it comes to implementation, we struggled with it. You know, we struggled with it a lot. The government has struggled with it. And I think one of the things that we're trying to figure out is what is the role of NGOs and civil society partners to be able to try and take on certain parts of that program. I think this is one of those amazing innovations, and I'm you know, and again, I'm just so grateful and thankful to Luigi and to UNICEF for sort of, you know, partnering on this initiative to try out this innovation. But this is one of those innovations, I think, where we try and figure out how do you maybe unleash the value of the peer educators? What is the value of the peer educators? How do you try and sort of, you know, examine that and figure out what more can be done? And this is also because we know from a lot of evidence about peer educators that the whole peer educator approach is a very contested approach. There's a lot of papers, there's a lot of research where people say, you know, peer educators don't, you know, is a good initiative because it helps to change the peer educators' behavior, but does it change the behavior of their peers? Does it affect the community? How much does it have a greater impact? And I think here we're seeing an example again of, you know, of a peer educator sort of initiated model, which seems to have, you know, definite impact at the community level. You know, again, part of what we're discovering here is the fact that, you know, it's not just about young people as recipients and as beneficiaries, and many people have said this before me, but I think just to make, you know, ensure that we're unlocking the value of young people as people who inform programs, people who implement programs, people who are the leaders in these programs. You know, it is often that communities see peer educators as being extraneous, as being an unnecessary part of a, you know, part of an outreach, as, and again, part of what I was talking about in terms of the backlash, you know, it is something that often communities don't see value to peer educators. I think you're trying to address that really wonderfully here by making them, you know, by making them very relevant to the communities. You know, it's, and I guess I'm going to just conclude here by saying, you know, it's wonderful to listen to you know, Alka, Rupa, and Muskan, and I think just to hear the fact that, you know, we see them as agents of change, and really there's a lot of change happening here. You know, you know, you see them, they come with energy. They're not tired. They're not used. They're not bored of the system. They're not tired of their work. They come with tremendous energy. You know, they come without biases. They're willing to sort of question the social biases, the social structures. They're willing to reach out to the communities, to everyone in their communities, and make sure that they reach all of those people who they need. They come with a willingness to engage in basics. They're not trying to make it complicated. Just hearing the kinds of issues these girls are talking about when they go to households, it's so nice to see that they're talking about simple issues that have huge impact, but they're not trying to prove that they are, you know, medicalized experts. They're doing the basics which really, really need to be done, and which can be conveyed so easily by them in the households and in the communities that they reach out to. You know, and I think probably most importantly is that they come with hope. They're very clearly speaking, you know, about a future and about the role that they can play, and they come with hope. So just to reinforce, you know, what Anna was saying, you know, they're not the future, right? The future is here today, and these people, these young leaders, are showing us the change that can happen today once we begin to invest in them. It's not an investment that we have to wait for a long time to see emerge. Thank you very much.
Thank you, Anand. Thank you. That was great. And what you just said about unleashing the value of a peer educator, and how it is important to engage these young, energetic people, not as beneficiaries or passive participants, but as active change agents in their own health and the health of their own community, basically. So, and also, I mean, just to let everybody in this webinar know that we are being joined by many of our peer educators from Sitamarhi. I really don't have a number because it's a live thing, but we will definitely get back to your 20 peer educators have joined, boys, girls, both, and they're so excited to hear their friends talking. And I think with all the technical glitches that they were, you know, they have, because they're not tech savvy as such. So, but they're still being able to join. Thank you for all the peer educators. जो भी peer educators ने join किया, thank you so much. और उनके parents ने भी शायद किसी ने join किया, thank you so much. Thank you. So I see a lot of very interesting questions in our chat box, and I will request speakers to answer these within the Q&A area. And I request others, all our participants, to please keep on posing questions. And I now invite Dr. Sunita Singhal, our Deputy Country Rep and Technical Director, to lead this session. A result-oriented design thinker, Dr. Singhal has successfully provided strategic leadership and technical guidance to EngenderHealth's Adolescent Health and FP programs in line with, you know, whatever emerging scientific evidence comes. So over to you, Sunita ma'am, for this very interesting, engaging Q&A session.
Yeah, so there have been very, very interesting questions in the chat box as well as in the Q&A section. Some of the questions have been answered by the educators, peer educators themselves, but I'll just take up these two questions which are about AGCs, these girls, that can any one of the AGCs share her motivation to join this initiative, and what is the level of support these peer AGs are getting from their parents and communities in general, and the most challenging behavior that they have faced. I think this part, a couple of them have already answered. Now, regarding the first two questions, I think can make the girls answer, but let me answer from my end. The peer educators are a part of EngenderHealth's RKSK our program in the district Sitamarhi. We have done an intensive work on the ground. Actually, we mapped the villages, we identified the peers, we engaged with their parents and the local leaders, and that is how these peer educators were actually allowed to come in and join the program. So we have picked up these PEs who were already working there, and so my assumption is that they really did not face a lot of problems in going after this AGCs, these new messages which they were supposed to spread in the community. So partially they were already motivated, and the permission from the parent and the local leaders was there. But rest, of course, we did face some challenges, some of them, because not 100%, all of them were actually able to join in. So having said that, now let me go ahead with the second question, which is about, how will EngenderHealth ensure the sustainability of the project impact with the AGCs? This is a very, very interesting question. And I think I will put it back on the audience that how will you take this initiative? The learnings that we've all shared with you all, how will you take it forward? So having said that, let me just share here that we have taken a feedback from all of these girls whom we oriented to the newborn care messages, and almost all of them have shared that they are ready and willing, in fact more than willing, that they will continue to spread these newborn care messages at any platform, any opportunity throughout their life. That is about from these girls. But the other point is that we also hope that all the participants through their programs will utilize every opportunity and platform and nudge this very small learning and help spread the messages and use the potential, the energy, the immense energy that we've seen in these girls, and take over and spread forward, not just this newborn care messages, but any other health messages or any other societal norm we want to change or we want to impact. So that's is our answer from our end. And any other question, please, you can raise your hand and we can answer back. And to my answer here, maybe I can ask Dr. Khera to add something if you want to add, Dr. Khera, particularly regarding this question of taking forward or maintaining the learning that we have from this small pilot.
Thank you very much. I think, Sunita, the point which is being talked about is the point of sustainability, and that point must be kept in mind. And to my understanding, this concept of peer educator, which is already an integral part of the RKSK program, but we have to use this program more strategically instead of spreading thin the whole population level. What we can do is we can identify small pockets of unreached population, and in those populations which are unreached, marginalized, who are not going to the regular schools, one can think of identifying adolescent girl champions. I think if we make it more strategic, the program will become more cost effective and impact will be high. And I think this will be called as the sustainable initiative, which can take the agenda of adolescent programming forward. I think, thank you very much. I think this is a really interesting question. And thank you very much for giving me this opportunity. Sunita.
Thank you, Dr. Khera. So if there are no more questions, I think you can continue posting your questions. We can take them over, respond to you in emails. And I think, Priyanka, we can now hand over the forum to Dr. Zoya. Yeah.
Yes. So thank you, ma'am. And please, I see your questions coming in. Please keep on posting your questions. We would respond to you via email when we'll be writing to you after the webinar. Then moving on to the next session, I think none of our discussions in this adolescent health space in India would be any useful if it doesn't reach or influence our next speaker. I would now like to take the opportunity to invite our very own Dr. Zoe Ali Rizvi for her concluding remarks and thoughts on this topic. So at presently, Dr. Zoya serves as Deputy Commissioner in the Ministry of Health and Family Welfare, Government of India, and heads the Rashtriya Kishore Swasthya Karyakram, or the National Adolescent Health Program in India. Dr. Zoya is also managing the newly launched School Health and Wellness Program under Ayushman Bharat to improve the health-seeking behavior and knowledge of our school-going children and young people. Over to you, Dr. Zoya.
Hi, good evening, Priyanka. I cannot switch my video on.
Ma'am, we're just helping you out.
Yeah.
Maybe Dr. Zoya can speak, I think. Yeah.
Okay, great. Yeah, I'll speak nevertheless, even if it comes on.
We can see you, ma'am.
Okay, you can see me. Great. Acha. Good evening, everybody. I have the difficult task of actually giving concluding remarks from such an interesting session, beginning with Dr. Khera, who gave us such a nice brief input about this 1,005 adolescent girl champions who have developed the confidence, who have the knowledge to bring about behavior change in new mothers. That's a very difficult task and very sensitive task, yet they have managed to achieve. That's a big congratulations to Engender and the support you have got from UNICEF and Packard for this. It's a very good step, and I'm so happy to be here to listen to the three wonderful girl champions who spoke so well, Alka, Rupa and Muskan. A big cheer for you, and I'm so happy for you all. So from Dr. Khera, if you go to Luigi spoke so well about the right to life, the right to health, the right to participate and to socialize as the girls on, which is a wonderful thought which you put across. Then we had Anna, who said that the adolescent health is something which is for now, which I totally agree with her. You have to look at adolescents being the future, not just the future, but the present as well. This is a wonderful point, and I totally agree. And of course, then we come to those wonderful girls, and Anand. Anand has set a beautiful background for me. I don't have to speak about my program at all because he gave a very good background and has also gone ahead and shared the challenges with we as a policymakers face with the states, with the funders, with our partners, and with the NGOs. So that having said, I would like to again congratulate Engender on having this great project in Bihar in a very difficult state and having to deliver so well. But only I think it's a few take-home points for me from the government would be actually that it is an intervention which has gone ahead and shown that the girls, the adolescent girls, can be empowered to make the right decision if they're given the right information. And this decision can help them negotiate life. And this negotiation can help them decide to make decisions about whether they want to work, whether they want to study, whether they want to increase their skills, what kind of life choices they have, what is the kind of access to services they can get, whether they want to keep studying. So that options, and that is the kind of empowerment which this adolescent health program really envisions. It envisions that every adolescent boy and girl has the information and is given that power to decide their life themselves. So that is the first very basic thing which I think this project has really done. These girls have gone ahead and made changes within their society. That is a big thing. The second part of this project, which I'm really happy to say, is that it fulfills a lot of little dots and little squares which we build for any intervention. And that is that it works in partnership with the existing program. So we already have Asha, who is working in the community with these pregnant mothers, with these new mothers. So that partnership of Asha with the new mother is already there. And these girls work with the Asha. And the Asha, we heard her speak. She was so happy to have these young girls support her. So this is a program which is going to already supplement what is there. So it is already building on current structure. Second, it is something which is really, it is thinking out of the box, which so many times we fail in the government. So we look forward to partners and NGOs who are working in the field to give us this input that, look, this is something which has worked by partnering with this, by thinking out of the box. So second is, it is thinking out of the box. Third is that it is a very innovative approach for accessing, for empowering girls, that Fourth, I would say it is a really scalable model. Like Dr. Khera mentioned, that sustainability is a big thing. So any small intervention like this, if it does well, even in a couple of blocks, it can be scaled across the district. So any model which is scalable always is of great interest to us. And I would request the state to look it up, because this is one intervention for increasing the girl's survival. But similar interventions can be done for so many other health issues which Bihar is facing. Similarly, other states are also facing. So this kind of intervention, this kind of out of the box thinking, innovation, which is scalable, and it is not really expensive. So all these little tick marks which we do in the public health program have been covered here. So congratulations, a big congratulations for Engender for doing that. And also finally, I would like to say that if our adolescent boys and girls have the knowledge, and that knowledge they share within their family, within the community, I don't see any reason why our community, our villages, our cities, our whole nation does not make healthy choices. So with that having said, and I'm again congratulating Engender and their support for having this wonderful intervention and informing the government also about it. Thank you.
Thank you so much, Zoe ma'am. We have duly noted your points, and you rightly talked about, giving these adolescents, young people, right knowledge to negotiate life, and then talking about partnership with the existing structures. And I'm so happy that you thought that this is like a innovative, scalable model, and this is something that we also think that, today we have done this with newborn care, and I think this approach has a huge potential to address many health issues that we all have been grappling for years in our health sector. Thank you, Zoe ma'am, and I think your insights will continue to instill passion in our work and guide us to do this good work, and it gives us even more confidence. So it's 5:47, and this brings us to the end of this webinar. A big thank you to all the speakers and the participants for actively asking questions, and all of you have enriched this dialogue, which shall continue, I promise. This does not stop here. A big thank you to UNICEF India team, Luigi, and the Packard Foundation, Anand, due to which organizations like us are able to take these small steps. And thank you, Dr. Zoya, for sparing your precious time and giving us this great guidance. And I'd also like to thank Dr. Khera, Anna, and Sunita ma'am for your amazing leadership and, and guidance on this. And a big shout out to all my champions out there and my team on the ground, Mini, Sudarshan, Manish, Vijay. You are amazing, and because of which EngenderHealth is able to show this kind of work. And thank you to my new concepts team. Thank you, Surki. You have been wonderful in this project. And to all of you there, if you have any further questions, please do send us at info@engenderhealth.org. And we will forward it to the speakers to whom the question is addressed. We will put up these presentations and this video of the webinar on EngenderHealth website, which Surki will be sharing. The link she's going to share on the chat box right now, and we'll inform you via email. Thank you once panelists for such a valuable time, and it was a pleasure to have you all. Thank you so much.